Hi, my name is Dana Atkinson, and I'm with the Foundation for Recovery, and I'm here with Heidi Gustafson, also from the Foundation for Recovery, and Richard Davis from the American Lung Association. Richard is the Adult Lung Health Program Coordinator. The Foundation for Recovery provides the opportunities for people and their families to achieve long-term recovery from the disease of addiction.
In conjunction with the Million Hearts Grant, the Foundation for Recovery is very happy to bring an American Lung Association webinar to you today, and specifically on how tobacco use is affecting the recovery community.
Hi, my name is Richard Davis, and I'm here to talk to you today about how to have a conversation about tobacco use with your clients and those people you love. Why do we want to talk about tobacco use? Because within the behavioral health community, approximately 80 to 90% of all clients smoke cigarettes. That's 44% of all cigarettes consumed are consumed by individuals with addictions or mental health comorbidities. Almost half, that's 200,000, of the 435,000 deaths that occur each year from smoking are among people with mental illness or substance abuse disorders.
Well, that's a big number. Thank you for sharing that with us.
Yes, more people in recovery die from tobacco-related diseases than from alcohol and drug abuse combined. Again, that's 200,000 preventable deaths each year. And then secondhand smoke is killing our family, our friends, and our community. There's some 53,000 deaths each year among non-smokers, according to the Communities for Disease Control, from secondhand smoke. There is no safe level of secondhand smoke. So how do you have a conversation about tobacco use? You keep it simple, you ask because you care, and you don't judge. Basically, you want to ask every person every time, do you use tobacco? You use the word tobacco rather than smoke because, especially young people, they'll use hookah or they'll bum cigarettes at parties, but as long as they're not buying a pack of cigarettes, they don't think of themselves as smokers. Or they might be using chew. So say tobacco, and in that way, they'll know it's not just smoking. And again, we ask about tobacco use because people with substance abuse addictions and our mental health disorders want to quit smoking. Studies have shown that as many as 80% of clients express an interest in tobacco treatment when they start treatment for their other addictions. And one study found that over half of all cocaine addicts, half of alcoholics, and almost half of heroin addicts were interested in quitting smoking at the time they started treatment for their other addictions. And when you ask people if they want to quit, that's going to increase their chances of making a quit attempt by about 60%. You start after you ask by advising all tobacco users to quit now. Be clear, be direct, be personal. Here's a good statement. Quitting tobacco use now is the most important thing you can do to protect your health and the health of your family. And I'm telling you because I care. Then pause for a moment and assess, is this person willing to quit? You might say something like, if I told you I could help, would you like to try to quit? Now some people think, oh my goodness, people in recovery, they're already dealing with big issues. Why add quitting smoking on top of everything else? But it's been shown that people who are being treated for behavioral health problems or substance abuse are able to respond to smoking cessation interventions at the same level and with just as high success rates as the general population. And that significant reductions in smoking can occur without any adverse effects on other psychiatric symptoms or recovery treatment. Advising people again to quit now is going to increase the chances that they'll make a quit attempt by about 60%. And those quit attempts are going to be just as successful for them as for anyone else. Part of the conversation involves what we call the 6 R's. So first of all, be relevant to the person you're speaking with. If they're a teen, they're not really going to care about health issues. That's miles down the road for them. They're immortal. That's not a big concern. What they are concerned about is appearance, how their teeth look, their breath, how they smell. That's what's important to them. So be relevant to who you're speaking with. And then if you did decide to quit, what would be your reasons? People who have a big, long, fat list of reasons for quitting are going to be more likely to stay quit and be successful in that quit than people who don't really have a good reason for quitting. And then help them to think about how they're going to reward themselves for quitting. Every time they smoke, they get a reward. So every time they perform a non-smoking behavior, they need to reward themselves for that.
Oh, I like that idea.
Me too.
And then they also need to think about what they're risking by continuing to use cigarettes. You know, what goals do they have in life? What about their families? How are they affecting those they love? And then you can help them think about roadblocks that they might have to quitting. There's words like, you know, I would quit but, or I'd quit except, or I'd quit and. Change those into success statements. So, I would quit smoking, but I'm afraid of recovery symptoms. To, I'm going to quit smoking and I'll be able to deal with my recovery symptoms through using nicotine replacement therapy. Or, I want to quit smoking, but I'm afraid I'll gain weight. To, I'm going to quit smoking and through a good diet and a good exercise plan, I'm going to keep the pounds off too. And remember that you're asking because you care. So even though you might repeat the advice to quit every time you see the person, it's not to nag them or to push them, it's just because you care. So like, let's say you've asked the person if they want to quit smoking, they're just not ready, they're not interested. That's okay. There's no judgment, there's no nagging, they're just not ready. Say something like, you know, I know you're not ready to quit today, but if you did decide to quit, what would be your reasons? And then leave it there. People who aren't ready to quit today may be ready to quit the next time you see them, especially if you've plant a little seed in their mind about why they would want to quit. Never nag, no guilt trips, no scare tactics, they just don't work. You could offer materials that will simulate their thinking about smoking, but only if they want to take it. You know, don't force it on them. You know, just by asking them if they would like to quit, you've increased the chances that somebody will make a quit attempt by about 60%. And then some people are just afraid they can't quit. They'd like to, but they're just afraid they're not going to be successful. So just reassure them that over half of all smokers have quit. They can quit too, and you're here to help them. You know, and then make sure that you arrange follow-up. You know, say, you know, I really care, so I might ask you about this again the next time I see you. Again, it's not to nag. It's just because I want to check in. Then, you know, as we heard earlier, about 80% of people who are entering treatment for substance abuse want to quit smoking. So a lot of people do want to quit. Help them with a very simple quit plan to make a quit attempt within the next 30 days. Think about a birthday, an anniversary, or some other special day for them, and circle that as their quit date. We'll have a simple form in the next slide that you can help them to fill out, and that makes it more real for them. Keep it simple. There's not a lot of lectures. It's just a very simple plan. And then suggest trying nicotine replacement therapy, like the patch, the gum lozenge. Those are all over the counter. Or they can see their doctor about prescription nicotine replacement therapies. So the quit plan, again, is very simple. My quit date is, and again, upcoming birthday, anniversary, holiday. Who are going to be the support people? This could even be a smoker in their life, as long as that person's willing to support them in their quit attempt. You know, what are their reasons for quitting? Make a big and long list. The more robust their reasons for quitting, the more likely are they to stay quit. And then make sure that they know to reward themselves for quitting. Think about the benefits of quitting. Again, for them, that might be something non-health related. It could be appearance. It could be more cash in the pocket. One of my first quitters purchased a car just based on the amount that they saved from their smoking habit.
Oh my. Yeah, cigarettes are expensive.
Yes, they are.
And then help them to problem solve. So if they try to quit if they made a quit attempt in the past, what worked? What didn't work? You know, get rid of excuses, backdoors, roadblocks, and anticipate challenges. Look for ways to avoid, alter, or find alternatives to smoking triggers. And then, you know, consider nicotine replacement therapy. That can really help. The urge to smoke will pass in 35 minutes, whether you smoke or not. So just don't smoke. And to help you to get through those 35 minutes, learn the 3 A's of shared responsibility: to avoid, alter, or find alternatives to smoking. The 5 Ds can also help. Delay, deep breathing, do something else, anything else, just don't smoke, drink water, deliberate thinking, and just don't smoke. And then make sure again to arrange for follow-up. Call or visit within a week of the person's quit date. And if they quit, yoo-hoo! Bells and whistles, balloons, take them out to dinner, celebration time. Now let's say they've slipped. They've quit overall, but they've had a few slips. That's okay. A slip does not a smoker make. Just help them to be true to themselves. So they should use their slip as a teachable moment. Reflect on the slip. What was happening that I smoked that one cigarette when I haven't smoked, for a week now. Use the experience or lose it. So use it as a way to not fall into the same trap next time. And encourage yourself. I've been not smoking. I had one slip. I can still keep going. It's okay. But let's say you come back to the person and they were never successfully quit, or they relapsed. They've returned to the same level of smoking that they had before they quit. Stay positive. Support those who relapsed by helping them to try again. The typical smoker makes 9 to 11 quit attempts before they're successful. And every quit attempt is a practice in success. Because the more you practice quitting, the more likely you are going to be successful at it long term.
And that's the same for the recovery community and substance misuse. We find that we have to try and try again, and it's typically not the first or second or even third time.
Right. Now, people say, well, my recovery comes first, and that's absolutely right. But smoking and cessation interventions improve outcomes for persons with substance abuse addictions and or mental health disorders. According to new research from the National Institute of Drug Abuse, alcohol and opiate addicts were at increased risk of relapse if they continue to smoke after completing treatment. And alcoholics and drug addicts in recovery who also stop using tobacco products are up to 8 times more likely to remain clean and sober than those who don't.
That's high.
Yeah, and that's really good information for people in the recovery community that think smoking's okay. I mean, it's directly tied to their success rate for a long-term recovery episode.
That's right. And what are the benefits of quitting? As soon as you quit smoking, 20 minutes after quitting, your heart rate drops to normal level, greatly decreasing your risk of stroke and heart attack. And 12 hours after quitting, the carbon monoxide level in your blood drops to normal. 2 weeks to 3 months after quitting, your risk of having a heart attack begins to drop and your lung function begins to improve. 1 to 9 months after quitting, your coughing and shortness of breath decrease. 1 year after quitting, your added risk of coronary heart disease is half that of a smoker's. And then 5 to 15 years after quitting, your risk of dying from lung cancer is about half that of a smoker's. Your risk of coronary heart disease is the same as that of a non-smoker's. Your risk of stroke is reduced to that of a non-smoker's. Even if you've progressed to pulmonary obstructive, chronic pulmonary obstructive disease, the progression of the disease is reduced if you quit smoking. And even if you quit as a senior, you'll add about an average of 4 years to your life by quitting smoking now.
Oh my. Wow, well that's all really good information. Thank you so much, Richard. So this is Heidi Gustafson, and I know everyone out there is saying, well, how can I stay informed about this stuff, and how can I stay current? There are a couple of websites you can stay tuned into, and one of those, of course, is ours at forrecovery.org. There's the American Lung Association at lung.org. Million Hearts, strokeassociation.org, heart.org, which is the American Heart Association, and any and all of these services have a Facebook presence, and it's very helpful to go like all of these organizations on Facebook, and you'll get up-to-the-date information as it appears on their Facebook page. We have more help to refer to. Richard, if you want to take...
Yes, if you're interested in stopping smoking, quitting smoking, or if you want to refer someone that you love to quit smoking, have them call the American Lung Association at 431-6348 for our Freedom from Smoking program. It's a great program. It's been in existence for 25 years. and is very effective in helping people to quit. Or sometimes people can't make it to a class, that's fine. Call the Nevada Tobacco Users Helpline at 1-800-QUIT-NOW. The helpline is staffed by licensed drug and alcohol addiction counselors, and they're there to help you.
Well, that's great. I did not know that. And the American Lung Association in Nevada, that's our local chapter. And one more time, Richard, if you want to talk for a moment on that.
We're in our second century now, and we're the leading organization working to save lives by improving lung health and preventing lung disease. We're fighting for air, and we'd love you to join us in that fight.
Okay, well, thank you. This, one more time, is the Foundation for Recovery. It's our Million Hearts Initiative, which is taking a look at how the use of tobacco impacts our recovery community. Thank you for your time, and we hope you tune back for future webinars.